Taryn Gibson, welcome to Limitless Live.
Thanks, Katie.
You're welcome. I really appreciate you coming on and chatting with me.
No problem. I'm super not comfortable.
Classic.
But I'll happy to talk to you anytime.
Thank you.
You're welcome.
Yeah. Also, for everyone listening, Taryn spells her name Taryn.
Good job.
Thanks.
Fantastic.
So Taryn is an IBCLC and owner of Greenville Weightlifting.
Yep.
Yes, here in Greenville. And IBCLC is International Board Certified Lactation Consultant.
I'm so proud of you right now.
Thank you. Yeah, I've learned a thing or two from you over the past few months.
Great.
So, wanted to bring you on to chat a little bit about some of your journey becoming and kind of working in that field.
Sure.
And I would love to kind of have you introduce yourself, tell us a little bit about your story and kind of what got you into doing what you're doing as an IBCLC.
Okay. Well, I have a bunch of kids. I birthed
How
5.
many kids?
I birthed 5.
Yeah.
And I have 6 altogether.
Yes.
One bonus kid. She's amazing.
Love
My
it.
oldest is 23, has a baby and a husband.
Yes.
And my next oldest is my bonus kid. She's 22, has a baby. So grandma times 2.
Love it.
And then I have an almost 13-year-old, an 11-year-old, an 8-year-old, and a 6-year-old.
Yes.
I breastfed all my kids except the bonus kid because I didn't get her till she was 7.
Yeah.
That would have been a little bit awkward, probably.
Probs.
Yeah.
Yeah.
So we didn't do that.
Yeah.
But other ones were all nursed fine. Got to Levi, who was my 4th.
Yeah.
And it was the worst nursing I had ever encountered in my entire life.
Oh, man.
And he was like 6 days old and skinny, and I was crying, and it was painful, and he was crying, and I would like try to return him to sender, but can't really do that.
Can't quite do that.
So I didn't know what was happening because I didn't have any problems with my other babies. And so I called an IBCLC, and I was like, she was my friend, fortunately. And she's great. She's an IBCLC here in town still.
Yeah.
And I was like, help, come over now. I don't know what's wrong, but he's skinny and crying and sleeping a lot. And I am crying and not sleeping a lot.
Right.
So she came over urgently, and she said, well, this is what's going on. And he had a severe tongue tie, which we see in some babies. And we developed a plan for pumping and feeding and getting the tongue tie fixed and getting him to a chiropractor to help with some of the tension in his body and all of that.
Yeah.
And it turned into great. He nursed until he was almost 2 when I had my next baby. And in that span of time of him nursing and me learning about all of this, I was like, maybe I'd like to do this one day. But I was a stay-at-home mom and not really wanting to work.
Sure.
But
Because he said he was your 4th, so
Yeah.
you'd already had 3 at home and plus him.
Yeah. And so then I had my next baby, and my friend, the IBCLC, she said, you should really come work for me. I'm getting busier in my practice, and you should really think about it. And I said, I'm good. Like, I don't really think so. I'm just going to stay at home. And she's like, but you're already very knowledgeable about a lot of things. It wouldn't take much for you to get certified and all of this. And I was like, nah, I'm good. Had my next baby. And she was one of those babies who, like, she nursed okay. She gained weight fine, but she was just very, like, unsettled while she was nursing. Like, it was hard for her. And she'd fight and, like, beat me with her little hands and want to switch sides back and forth. And it was just not great.
Yeah.
But she also had a tongue tie. And my friend was like, look, it's not, like, urgent that you get it done, but it will probably make things a lot better for you. She's just not using her tongue well. She just can't. And so eventually I did get her tongue tie release, and it was very much better. And then a couple months after that, my friend said, so I've just hired you, and you're going to be my new assistant. And I scheduled, I've scheduled us a visit together to go to a client's house. And so this is your new job. And I was like, no. And she said, yes. So I left my almost 1-year-old with, I don't even remember, I guess my husband at the time or sibling or somebody.
Sure.
And I said, let's go. So we went, and she said, basically, I want you to watch how I handle this visit. And then the next visit we go to tomorrow, you're going to do it. And I was like, oh, well, guess I'm doing this. And so then I embarked upon my journey of taking a lot of lactation specific classes, finishing up some other classes I needed to take, and doing a whole lot of clinical hours under supervision.
Can you tell me and our listeners a little more specifically, like just the IBCLC? Because there's so many different types of lactation consultant certifications and all those different things. So what does it look like to be like internationally board certified and, you know, some of the other different types of consultants out there?
So there's just like lactation consultants. Anybody can say, I'm a lactation consultant. And there's no real, yeah, sure. There's no real like
you don't want me to be your lactation consultant.
There's no real like I don't want to say there's no oversight, because the oversight is for like only IBCLCs.
Okay.
So there is a board, it's called IBLCE, and they certify you, and that's who you take your exam through and all of that.
Yes.
But nobody's going to come after you, and if you say, hey, I'm like helping moms breastfeed, there's nobody that's going to say like you're doing anything wrong.
Gotcha. Okay.
Basically. I mean,
sure.
I guess somebody could come after you at some point, but it doesn't really happen.
Right.
And then there's like a CLC, a certified lactation consultant. There's breastfeeding educators. So you can take all these classes and get certified. Mm-hmm. And some of those certifications are great. Like if you want to teach prenatal classes on breastfeeding and you want to be a CLC, there's absolutely nothing wrong with that.
Yep.
But IBCLC is kind of like the gold standard, I would say. You take an exam that is the same, is given worldwide.
Yeah.
And you have to be on the same standards as everybody else who's taking the exam.
Yep.
So
very objective.
Yeah.
And just a little more formal processing.
Yes,
probably.
Exactly. Yeah. There's 3 different pathways you can go through to become an IBCLC. If anybody's interested in that, you can go on the IBLCE website and see them.
There you
go. Some people, if you're already an RN, you don't have to do as many specific classes, or, it's just slightly different.
Right.
Or if you've taken, like, say you are, you're a physical therapist, mm-hmm. you would not probably need to do the same pathway I did, because I don't have a degree in the medical field.
Sure. That makes sense. Yeah.
So I did 500 clinical hours.
Okay.
In about 18 months.
Yeah.
And then took all these specific classes. And then took my exam. You have to recertify every 5 years.
Okay. So there's a recertification process, staying up to date with all the education, all that kind of stuff.
You can take continuing education classes. You have to take an exam, basically, or like an assessment every 5 years, and it'll tell you what areas you're lacking in, and you should take continuing education in those classes. Or you can just take the exam and recertify.
Nice.
I haven't decided which one I'm going to do next year.
Yeah. I was going to say. You have options.
I know.
Well, tell us about Clever Baby, because that's your business. Mm-hmm. That's Clever Baby Holistic Feeding and Parenting Support.
Yeah.
On the shirt.
Yes,
on the shirt. How did that come to be your own?
So I was working with my friend, and once I got all my certifications and everything, the plan was always that I would go out on my own.
Sure.
I like working by myself, not necessarily like by myself, but I don't want to work for anybody. I'm super independent.
Yeah.
Just me.
There you go.
So that's what I did. And I searched long and hard for a name, and all of the good names for lactation, like, I don't even know. You could have just said Taryn's Lactation Service, I guess, but that's kind of boring. But I was like, Clever Baby's pretty cute.
That is cute.
I like it. Like, I'm working with babies, and we get them to be like up to par, and they're clever. And when you graduate, I give you a little sticker with a baby with a little graduation hat on it.
Exciting.
It's pretty cute for your water bottle. Yeah.
Maybe I'll get a sticker. I hope I'll get a sticker.
Yeah, you should.
Okay.
I'll give you one. Or 2.
Or 2. Okay. Cool.
Or 3, because I really like you.
Oh, thanks, Taryn. I like you too.
Great.
Yes.
I started with an office in Spartanburg. I've been there for as long as my business has been going.
Yeah.
I probably will. I'm moving out from that current office because the people who lease the big office that I sublease from are moving to a different location. Nice. So I'll probably be finding another office space in Spartanburg. But I also have one in Greenville.
Yes.
5 minutes from here.
I was going to say, not far.
I know. It's
not
close.
Far. Yeah.
And I like it. There's a midwife and a PT and a chiropractor that also lease space in that little suite.
Yes.
So we work well together.
Yeah. That's nice to have kind of like one-stop shop for moms and kiddos.
Yep.
Which is really nice.
Yep. I do home visits too. Mostly that's for like immediate postpartum. If somebody's having problems like up to 2 weeks after delivery, I'll go see them at home.
Sure. So walk us through now, like kind of like your client's journey. So for someone who's coming to see you, ideally in a perfect world, you know, kind of what that looks like from prenatally to postpartum and kind of how you're assisting somebody along their journey with nursing and breastfeeding.
So we'll use you as an example.
Okay.
Great.
Yay.
I think you were like 34 weeks, right?
Yeah. Or that's what I think you had told me at 34 weeks to like see you. And then when I was 34 weeks, I texted you and was like, hey, I should come see you now.
Yeah. That's
okay.
Good.
Yeah.
It's a good time. I feel like if I see people much earlier than that, they tend to forget a lot of what I said, even though I'll like write down important things and send it to you or whatever we talk about. If you need a reminder, I'll send it to you. But I feel like if I'm seeing a mom at like 25 weeks, by the time they go roughly, 3 or 4 more months, like before they deliver, it's like they're not going to remember anything.
Sure.
So 34 weeks is ideal. It's usually before any moms go into labor. And we just go over best kinds of breast pumps to look at, best kinds of bottles to have on hand. Some moms ask about like if they want to use formula or donor milk, if something's going on, should they have that on hand? We go over that. Basic positioning things, and we go over like when to call me. Like if things are going great, still schedule a visit with an IBCLC because just to check in, even if you only see them once or twice after delivery, get the baby weighed. Just make sure nothing else is going on. Most of us are very well versed in like holistic care. So we can tell you, hey, the baby's reflexes look a little wonky. Maybe you go see a chiropractor for that. Or your baby's got some really tight muscles on the right side of his neck. Maybe go see somebody for cranial sacral therapy or some other kind of body work.
Right.
And of course, tracking weight. We see moms from everybody who like goes to the pediatrician on day 2 of life to moms who don't see anybody. They have like unassisted home births and they just prefer to do everything themselves. I see like the full spectrum. Being able to check in with somebody along the way is good.
Yeah, that's awesome.
Most moms call me, either they have like their significant other, their best friend, or they call me when they're on the way to the hospital or birth center, or if they're having a home birth, they're like, hey, just so you know, baby's on the way, so I can have a heads up of like when to book them in.
Like birth support.
Yeah.
Birth squad.
Yep. Exactly. That's a big part of it too, is just having somebody you know is going to be there. Like, can they text me at 2 a.m. like on day 1 of life? Sure. I might not see it, but also like they could text me and I'll answer it when I get up in the morning.
Sure. I'll schedule send if that does happen.
Okay. That's fine.
Be like, send this to Taryn at 8:30 a.m.
That's fine. That's great. I'll probably wake up and answer your text in the middle of the night, honestly.
Cool.
Yeah. But yeah, seeing people around 34 weeks is great. And then usually after delivery, when your milk comes in, is usually when I see moms.
Which is when?
Usually 2 to 3 days.
Okay.
After delivery.
Yeah. Which was new news to a lot of people. Is new news to a lot of people.
Yes. Some first-time moms freak out because their milk is not in right away. And they're like, I have no milk to feed baby. But colostrum is enough for your baby.
Colostrum. What is colostrum, Taryn?
Do you want the scientific definition or just the run-of-the-mill definition?
Yeah, either one.
Let's give you the casual definition.
Yeah, give us casual.
So colostrum is produced sometimes before you even have your baby.
Yeah.
And it is nutrient dense, very thick, very hard to pump. But your baby is usually very efficient at getting it out, and they only need a very small amount after delivery until your milk comes in.
Liquid gold, right?
Basically.
Yeah. So that is what baby is feeding off of for the first couple days.
And most babies are born with enough like fat stores that they can go several days or longer. Not ideally, but they can with just colostrum.
Which is crazy. Our bodies are insane that they produce just exactly what baby needs at the right times. But I think that's really helpful information for especially first-time moms or moms who haven't breastfed before, going into that journey. Because I'm sure the mental and emotional components of having just given birth and trying to navigate a whole new life stage, and then you're like, my body's broken, what is happening to me? Why is this not working? So how do you help guide new moms through kind of that stage of just like the newness and like helping them better understand what's going on with their body.
I think talking about it prenatally is super important.
Yeah.
Also, I'm very matter of fact, in case you haven't met me yet. I'm just
She
like,
is.
look, you're going to get through it. It's going to be fine.
Yeah.
Like, you got to trust your body. Of course, I do have some parents that are like, I'm more comfortable with giving a bottle of formula or whatever in those couple days. And that's your choice as a parent. I'm not going to diss you for it.
Yeah.
Like, you do what you want to do with your kid.
Yes.
But also, like, this is how our bodies are intended to function. There's a reason why your milk doesn't come in right away. It's because your baby needs that concentrated bit of nutrition. Their tummies are only this big when they're born, like the size of a peach pit, maybe.
So tiny.
Yeah. So really just drinking like a teaspoon of colostrum is plenty.
Mm-hmm. Right. And in terms of feeding schedule, so for a new mom kind of like walking into this new season, they plan to breastfeed, they want to breastfeed, expectations surrounding time
expect to spend a lot of time nursing your baby.
Yeah.
Especially in the first couple weeks.
Sure.
Newborns will nurse anywhere from like 12 to 20 times a day. I feel like every hour and a half is pretty average for the first couple weeks.
Yeah.
Usually babies take a long stretch at night. And by long stretch, I mean like maybe 3 or 4 hours.
Mm-hmm.
And that's fine and normal as long as everything else is going well.
Right. They're gaining weight. Mm-hmm. They're doing all the things they need to be
pooping
doing.
well. Yes.
Yeah.
Obviously getting baby to breast after birth is ideal, like in the first couple hours afterwards.
Yeah.
Ideally within the first hour. But
sure,
I would expect that most moms spend the majority of the time feeding themselves and feeding their baby.
Yeah.
For the first couple weeks. It's helpful too, a lot of moms like want to get up and go. Like sometimes you feel really good after you give birth.
Sure.
And it's important to remember that you went through a trauma physically as well as the baby. And there's also like emotional trauma in there too. Like you're separated now, you're not together. So considering all those things, like stay in bed and feed your baby and have somebody bring you food.
Yeah.
Warm food. Comforting.
Right. Yeah. I've been doing, my doula is coming over this weekend. We're going to do some like postpartum meal prep and like preparing for some of those things to have the warm, nourishing foods that can just help with healing.
Bone broth is great.
Yes.
Make a lot of bone broth.
Yes.
And soups.
Yes. That's what we're going to do. But yeah, that expectation, I think, because, even me having never breastfed a baby before, knowledge I think is super helpful, or actually like having that expectation going into that season versus kind of going in blind and being like, oh, I did not realize that this was going to be as much work or effort or time.
Right.
That this was going to be, and sometimes it doesn't work for people and that's okay. Like, but other times it's like, if you genuinely want that to be something that you provide for your baby, and baby is, you talked about tongue ties and some of the lip tie and like, all that kind of stuff that can inhibit, progress. But overall, like you said, most people, if you give it some time and practice, you can work through it.
Sure.
Which is good. Talk to us a little bit about some of maybe those little roadblocks that sometimes come up for people that you see, and how you can provide guidance and support, and maybe other providers that can also provide the support during those kind of little roadblocks that people might run into.
Sure. Well, for instance, I see babies that come in and it's super painful for mom to nurse them. Mm-hmm. So I usually get those babies before a week of age because the mom is like, just like I was with my son, like I cannot feed this baby on my boob anymore. Like it's painful. I'm crying. My toes are curling up. And oddly enough, in the summer, when I see moms who come in, they're complaining of pain while nursing, I watch their toes. That is an excellent indicator of how painful it is.
Sure.
Their toes curl up and they're like real tight. Yep.
Yeah. That's when it's like, man. So so even with that, tag a little more on to, what is normal pain versus what is not. So I would say pain.
A little discomfort
Yeah.
is common and pretty normal.
Sure.
Like, you're not used to having somebody latched onto your nipple 20 hours a day, potentially.
Sure.
So that, okay, fine. It might be a little uncomfortable or like feel a little raw. You put some nipple butter on there, feels better. maybe some silverettes. So those are like the little silver cups. They're great for like nipple damage. But if you have damage, or it's so bad that your toes are curling up, or you literally feel like you can't feed your baby anymore, then that is not normal. It might be common, and I'm sure you know, like it's common in pelvic floor therapy where people come in and they're like, oh yeah, when I cough, I pee on myself.
Right.
But that's not normal.
You know that's not normal.
Yeah.
Common.
Does not equal normal.
No, definitely not.
So it is common that people have pain while breastfeeding, but it's not normal. It shouldn't be painful.
Sure.
And there's reasons for that. You know, like, is the baby just not being well supported while latching, or
positioning?
Yes. Okay. Or does baby have a tongue tie where the frenulum under the tongue is so short and tight that it prohibits baby's tongue from cupping the nipple, and instead the baby's like chomping down, or, you know, 1,000 other oral function issues. Right. It could be that maybe mom has an inverted nipple, or like I said, there's 1,000 things.
Yeah.
But all those things are good reasons to see an IBCLC.
I was going to say, if there are roadblocks that do come up, this is the same thing for pelvic health and pelvic floor. It's like there is help for it.
Yes. Yeah. Don't try to tough it out.
Right. Don't try to tough it out. Oftentimes these things in the pelvic health world specifically don't really resolve on their own.
Right.
Like it's those things that persist past that like 6-week postpartum mark, especially. Like, get some guidance if you're experiencing these symptoms. So is that similar to breastfeeding? Like,
I would say if it is painful for you, see somebody.
Yeah.
Like immediately. Don't try to say it's going to get better. It probably won't.
Yeah.
So
okay. Yeah.
Come in right away, or let me come to you right away.
Sure. Yeah. Find somebody who can come meet you where you are, so you don't have to scramble or have stress leaving the house or all that kind of stuff.
Going back to the whole trauma of birth.
Yeah.
Even though you might have had like this wonderful birth and like very peaceful, or whatever it is that you envisioned.
Sure.
It's still a trauma of sorts.
Definitely.
So keeping that in mind, I always recommend body work for moms and babies too. If you want to go together to get body work, like go to the chiropractor, get adjusted. Chiropractors will come to you postpartum.
Right.
Or cranial sacral therapy. That's another form of body work that's very good at working on relieving tension. Yep. Babies have to slide under the pubic bone to come out. So that right there cranks their neck, and all their muscles are cranked sideways. They've been in the womb all curled up for so long that sometimes they just are born with a lot of tension in their bodies, and they need to be worked with to get rid of that.
Right.
It's very hard to nurse when your baby's chin is tucked to their chest because they're curled in a little ball. Yes. Yeah. I mean, try putting your chin on your chest and drinking out of a straw. It's impossible.
Right.
Close to it. It's just not comfortable.
Sure.
So I refer out, babies for things like that. I've referred out to osteopaths, and I've referred out to Rolfers, which is more body work. It just depends on what you and your baby need.
Right. That makes sense. And it's individualized, to whatever is needed.
I mean, I saw like a little meme on Facebook yesterday, and it was talking about like how some people think that the only thing IBCLCs do is like see a baby and, oh, it's got a tongue tie, and send it off to the dentist or whatever. And that's really not what I do. I mean, sure, some babies are tongue tied, and the best way to resolve that is with lots of body work to relieve tension.
Sure.
And then sending a baby to get that lasered, because it's a birth defect essentially, where the tongue doesn't separate from the floor of the mouth completely. Right. So you have to fix that in order to like make things go smoothly. And even if you have a baby who's tongue tied and you choose not to breastfeed, I mean, it affects bottle feeding too.
Sure.
So those are all things, we're not just saying, hey, your nipples hurt, go get your tongue tie fixed. It's fine.
Right. Yeah. Is there a way, even just based off of feeling or positioning or latching, like that a parent would be able to identify that their kid has that, or they could suspect that they would have a tongue tie or a lip tie or something like that?
It's talked about a lot on social media now. So I think that like some parents at least would be more aware, especially if it's more of an anterior tongue tie where it's tied all the way to the tip, and the tongue looks like heart shaped. They'd be like, that's not normal. Even in a hospital though, some hospitals the nurse be like, that might be a tongue tie. You should get it checked out. But they're not going to tell you, and they're just really not knowledgeable. It's just not what they're trained in.
Sure.
And it's important to note, too, just because a frenulum looks short doesn't mean that the function is poor.
Yeah. Function's more important than structure.
Appearance,
Yeah.
So I feel like that's super important, too. You might look at a baby and be like, wow, that frenulum looks really short and tight, but they're nursing great. They're gaining weight great. When we do an exam for oral function, everything looks great. Like the tongue can sit in the palate or, all these other things. Like, I'm not just going to send somebody to get their baby's tongue lasered because it looks bad.
Right.
Quotes bad.
And it's asymptomatic.
Yeah.
That makes sense.
Yeah.
Yeah. There's some pelvic health things that are similar to that as well. And working on, managing symptoms and continuing to give function, more importantly than being so caught up in a structure or position of something.
Sure.
In the future. So, so it sounds like your journey to become IBCLC was kind of one personal, work. And it sounds like your first 3 kiddos, you did great. Like you didn't have any issues. So what would you say to moms who have had kind of similar experiences when maybe they thought they knew what they were doing and they thought they had it all going on?
Right.
But then they run into, with their 4th kid or, 2nd kid, 3rd kid, 10th kid,
Yeah. I mean, there could be any number of reasons for the start of a breastfeeding journey just not going well.
Yeah.
I mean, it could be that your 4th baby has a tongue tie. It could be that, I don't know, in between you thought you weren't having any more babies and you had a breast reduction, but you still want to try to breastfeed your next baby. There's any sorts of reasons. And I would just say, hey, once again, go see an IBCLC.
Go see her.
Me. Because, I mean, you never know what trouble can crop up.
Right.
Honestly.
And just seeking help, like being willing to kind of like go and get a little extra support. I think that that's one of the biggest things, just that women being able to have that support postpartum.
Yeah.
And whether it's the family, the birth team, IBCLC, your doula, your providers, whoever you so choose, support. And I'm obviously about to walk through that myself. But setting yourself up for that, I think, is really important.
It is.
Because it's a season of life that is, for most people, especially the first time, it's so unknown and you have zero clue. You can kind of know what to expect, but it's still until you experience it. Right. I feel like
I think you're going to do great, though, because you ask a lot of good questions and you have support. You have a doula.
Yeah.
And you are well-versed in like the medical areas of things, like how things work.
Yeah.
So hopefully you'll let that part of your brain like click in a little bit too.
Oh, for sure. Yeah. I think I'm grateful to be a pelvic floor therapist walking into birth and postpartum, just because I do have more of that understanding and knowledge of what changes my body, is going through, what my body's actually doing during labor, like all that stuff doesn't scare me. It doesn't give me, anxiety or anything like that. Like I know my body is capable of birthing a child. Like, it's, for me personally, it's the postpartum. It's like, holy smokes, like postpartum, keeping this kid alive, like feeding a child, all that stuff.
I say a lot. All you need is to feed the baby.
Yeah.
You need something to like catch poop.
Yes.
So whether you cloth diaper or disposable diaper, or you can be wild and do elimination communication.
Fair.
That's wild.
I've seen it. So funny.
One of my favorite midwives teaches classes on elimination communication.
Yeah.
And a lot of parents have good success with it, which is crazy.
Which is wild. I'm not gonna lie, I've seen that pop up in my algorithm a couple times.
You should not necessarily try it unless you really want to.
But probably not.
It takes a lot of commitment, I feel like, for the first little bit. But once you realize, like, most people know when their baby's about to poop.
Sure.
Like, even in the office today, one of the moms was holding her baby and she's like, yep, she's about to poop. Sure enough, like 5 seconds later.
Yeah.
Lots of poop.
Sure.
So like in that 5 seconds, you can legit like hold the baby over the bowl.
Yeah.
And it poops and no diaper.
Hey.
It's wild.
That is wild.
But hey.
Capable. We'll see. We'll have to see how it goes.
let me know.
I'll keep you posted. But no, I appreciate that. I think that it's, the lactation consultant, that was like one of the first things that one of actually my former patients told me was like, you need to make sure you have a lactation consultant.
Yeah.
Because she had a hard time, breastfeeding, and that's something she really wanted to do. It's something I really want to do too. But I also am trying to be as open-handed with everything as possible to make sure that I'm, enjoying the process.
Yeah.
Not holding too tightly to any one thing.
It's good
At this point.
It's good to have goals.
Yeah.
But also realize that your goals can change.
Right. Yeah, exactly. And so, with your line of work and the people that you are working with, how late can you support someone postpartum? Like how like long?
I think the oldest baby I've seen was about 22 months.
Okay.
So those parents were missionaries, and they came back to the U.S. for a few weeks.
Yeah.
I think it was like 6 weeks they were here.
Sure.
and the country they're stationed in does not do anything about tongue ties or anything like that. So she was still nursing, although she basically had to tough it out for the first year while he nursed a lot. It was very painful for her, but she's like, I'm going to breastfeed this baby, dang it. I'm just going to tough it out, because their other babies were also tied. And so she was already used to it. And she was like, we're just going to do this till we go back to the U.S. and get it taken care of.
Sure.
And so I was willing to work with them. I saw them in the office. Then the baby had he was a toddler by then, had his tongue tie released. And then I followed up with them via telehealth for after they went back to their country where they were.
Nice.
Yeah.
Yeah.
But I'll see anybody basically as long as the baby's still nursing.
Yeah. Okay. That's good to know. Cause I think that's something kind of, I guess a, presupposition or thing people think of lactation consultants as mostly being in the hospital or soon after birth versus you can extend that out if you're still having or needing.
I saw a baby, who was 6 months old and had never breastfed before. And it was just being fed express breast milk. And we got that baby, and the mom, I should say.
Yes.
Got that baby back to the breast, and she's still nursing, and she's 3 now.
That's awesome.
Yeah, that was a good story.
That's a really cool
One of my
story.
favorites.
Yes. I mean, and most people don't know that that's even possible.
Yeah. That's I really enjoy, I think, this line of work, because it's also not just a job.
Yeah.
Similar to you, you care about the people you see, and it's not just being a bank teller where you're like, yes, thank you, it's my job every day, same monotonous, right?
Sure.
You see these things, and it's a personal challenge for me.
Yeah.
Somebody comes in with a 6-month-old baby, and they're like, my baby's never latched and I want her to nurse, and I'm like, let's do it,
let's go. You're like, bet.
Yeah,
I got this.
Yeah, it's great, because I'm very tell me I can't do this.
Sure.
Tell me I can't go deadlift, whatever.
Right.
I will make sure it happens.
Yes.
One way or the other.
Yeah.
So yeah.
Love that.
Yeah.
That's so cool. Are there any other myths surrounding lactation consulting or your job or what you do that you just want to bust for us real quick before we head out?
I need 5 hours to think about that.
I know. That's kind of a hard question.
Myths about breastfeeding in general?
Sure. Yeah. Just anything you think that someone might benefit from knowing.
I don't know if it's necessarily a myth, but one of the things that I would say irritates me a little bit, maybe.
Sure.
Not angers me. Or okay, maybe angers me a little bit, but is the whole scheduling feeds, I don't want to call it a movement.
Yeah.
But you have all these different social media influencers or books you can read or courses you can buy. And they're like, oh, feed, wake, sleep is the normal window for normal schedule for a baby. And I'm like, okay, well, if you're hungry, you eat, right? Okay, for the most part. You're an
adult, yeah.
So baby, scheduling feeds for a baby, especially a very young baby, is just not wise. And I understand that some people are more a type A personality where they thrive on a schedule.
Sure.
But I think also being realistic about that and realizing that as a parent, you're bringing a baby into the world and it's going to rock your world, and you're not going to be able to live happily for a while the way you have been.
Right.
If you try to keep up the same level of
structure.
Yeah, that's it.
Yeah.
Does that make sense?
Oh, it makes total sense. And which is partly why I'm trying to go into this journey with like low expectations surrounding, or like no expectations surrounding what time, schedule, you know, all that stuff looks like, because it's like the first, 3 to 8 months of 6 months, 12 months, I don't know, of life. It's like, you know, we could be as structured as we want to be sometimes, but like you said, looking at both mom and baby, what's best for family, you know.
And I think a rough schedule is good for a lot of people, but I just I don't see a lot of success with moms and dads who come in and they're like, we feed this baby every 3 hours religiously on the dot, and then we keep it up for 30 minutes, and then the baby can go to sleep. And I'm like, okay, I try to keep everything as biologically normal as possible in every way. So normally a baby will nurse to sleep. That is normal. Yeah. It's not normal, by the way, if you're feeding and your baby falls asleep after 30 seconds after every feed. That's not normal. But for a baby to get a full feeding and then fall asleep at the breast or even with a bottle, that's normal. And that's what should happen. That's how our bodies are designed. Yep. So it kind of rocks that natural rhythm when you try to overly schedule feeds.
So for those who are not overly scheduled and are kind of, you know, just going with the rhythm of the baby in life, how do they know when to feed and when not to?
You look for hunger cues, basically.
Okay.
A late hunger cue is crying. So if the baby gets to the point where they're crying frantically, you miss the other 47
hunger cues
before. Basically, when your baby wakes up, you should expect that they're going to want to eat. So hands to the mouth is one.
Yeah.
Smacking their lips, licking their lips, looking around like with their mouth open. Especially like the rooting reflex. You accidentally maybe touch the baby's cheek and it's like fishing over in that direction for a nipple. Yeah. You should probably feed your baby.
Yes.
And don't worry about changing your baby's diaper before you feed, because probably your baby will poop mid-feeding. So like in the middle of the night when your baby wakes up, don't be like, oh, let's look for a clean diaper and do all these things, because your baby's going to be really mad.
Sure.
And then everybody's awake.
Right.
So like, feed your baby, then maybe change the diaper. Finish feeding on the other side. It works a lot better. It's my personal advice for you.
Great. Thanks.
No problem.
That's good.
Yeah.
I'll need to take that. I'm sure. That's awesome. No, these are all such great tips and such great information for people just wanting to know more about what IBCLCs do, what you do. So if someone's wanting to connect with you or work with you, tell us how they find you.
I have a website.
Great.
Also have Facebook.
Yes.
Also have Instagram.
Okay.
It's all under Clever Baby or myself, just Taryn. The website's not under Taryn.
I was going to say.
Website's cleverbaby.com. Cleverbabyholisticfeeding.com.
Okay. There you go. All right. So if any of you guys are looking for lactation support.
And I do take insurance. Not all insurances cover lactation.
Yeah.
Medicaid, no.
I know.
They don't cover anything.
Man. They don't.
I know. That's bad.
Yeah.
But most insurance, I can figure out a way to make it work.
Which is great.
Yep.
So hit Taryn up if you need some lactation support.
Hit Katie up if you need some pelvic floor therapy.
Yeah, that too. We can help you with a whole host of issues, mom and baby together.
Yep.
So
true story.
Yeah. Come to Limitless. We got it all under, well, you're kind of under our roof.
Yeah.
Not for weightlifting. That, but yeah.
Also, I run the dog rescue. So if you want to adopt a dog.
Nice. Yes. Yeah.
Or foster a dog.
Yeah.
Don't give me your dogs though.
No.
Don't want any more of those.
Yeah.
But if you want to adopt a dog or weightlift.
Yeah. Greenville weightlifting is
or
here
breastfeed your baby.
Hey.
Or bottle feed your baby.
Yeah.
Or pump and donate milk to somebody else. Hey, I'm here for it.
Love it. Thank you so much for coming and chatting. This is great.
No problem.
All right. Until next time.
Bye.
Bye.